I'm talking to Dr. Tom Larkin from Lexington, Kentucky, and we're standing outside of the Bob Barkley Study Club in Roanoke, Virginia, that Dr. Paul Henny is conducting. You were here all day yesterday, starting from the morning, going to the late last night, and then all day today, where you presented as well as listened. Talk to me a little bit about yesterday. Dentists were talking about their practices and how they are implementing co-discovery.
Right.
What was the takeaway in listening to that?
So I have been a fan of Bob Barkley. For probably a decade ago, I saw quotations from him on the internet, just random quotes, and I would put them in my presentations because I thought they were so profound. And then on Facebook, I saw the Bob Barkley Study Club. And I said, well, this is interesting. And then I saw Dr. Paul Henny's dedication to the life and work of Bob Barkley, and we were in communication since then. So this has been a great experience for me to kind of see culturally his group of people. So he attended an event that I had this past spring and invited me to come to actually see the study club in action, and it's been awesome.
Well, you're quite a student. I mean, I listened to your presentation today, and you're just reaching out into anything that sounds interesting and effective.
For sure. I'm an investigator, and I love doing that. I love learning, a lifelong learner.
Do you see a comparison, to compare yourself to Paul Henny? I mean, similar personalities, would you say, or does he approach it a little differently?
No, Paul's a deep thinker. That's why I love him.
Oh, I see. Yeah.
So in my presentation today, I said, Paul helped me with this presentation. He didn't know it, but I read his posts and I glean concepts, right? And he loves to write, and he writes volumes, and I'm not that person, right? I'm a gleaner. I just glean concepts.
Right. Well, it sounds like a good combination.
It's great.
Yeah.
It's great.
Yeah. Well, what's your takeaway on how people are responding here to your message?
Yeah, it's been special. Between Dr. Emily Stein and myself, and Paul did this very intentionally, right? Mm-hmm. Because the people yesterday that did the co-discovery, the focus on this concept of total health dentistry. And from my understanding, there's a lot on occlusion, TMD, or whatever. And what Paul was wanting to do was to move the needle into the biological a little bit. And that's why he invited myself and Emily. And I think we got a lot of attention very quickly. Because to me, this concept of total health dentistry is everything. Okay, it's function, it's cosmetics, it's biological, it's the totality of what Bob Barkley was kind of dreaming about. And I think that's what Paul is in the process of kind of threading together.
And now it's possible with our new technology, new awareness, new tools.
Yeah. The tools are the important thing, like the ozone, the Bauscher, the electrolytic ozone, who he's presenting on right now. Emily Stein's new technology. I've been successful in seeking out these people. I'm looking for people that are bringing solutions to the marketplace that can move the needle in this whole concept of prevention and what we can do in total health dentistry.
How rigid is the health industry in terms of change and adapting change?
The
I
industry,
shouldn't say how rigid, I say how acceptable are they? Because I think they're rigid. I'm determined.
No, I get where you're coming from, and they're not very acceptable at all. That's why I kind of run my own show, and I don't want to have to conform to things. I've always been a little bit of a free thinker, and I kind of assemble my own tribe. Paul's kind of assembling his own tribe, because a lot of the things that we're needing to do, I talked about it this morning, evidence-based, university-based, organizational-based, it's slow going to accept new things.
Hasn't it always been? I mean, isn't that the history of medicine?
Yes.
A couple hundred years ago, and how they got kicked out of the profession. Absolutely.
Yep.
And they were totally right, like washing your hands, for heaven's sake.
Completely ostracized. Dr. Kais, who trained me, completely ostracized. And what happens is, when you're long enough, the people that are right surface to the top. So he was right with this whole concept of bacteria and periodontal disease, and then you see Dr. Stein, how she's taken that with her brilliance to an entirely new level of understanding.
Right.
And so, it's the right time, and Paul knows it. It's the right time for this message. I've been kind of singing this song for about 10 years.
Yeah, you have a good melody. And the mouth evidently is very important to systemic health.
Well, and Dr. Stein has taken even my level of understanding to another level. I have had a general awareness of this, and then you listen to her speak about the microbes and interacting and traveling. As soon as your gums bleed, you got problems, okay? And so this is really important. I mean, I'm learning from here. We all learn from her.
It's going to change dentistry.
Yeah.
What do you think it's going to do? How long it's going to take to
you know,
implement change?
For the independent practice of dentistry, this is going to be the trend, okay? One of the things that I talked about today is that this is not a very scalable model. It's not scalable for multi-clinics, for DSOs, sort of things, because it's high touch, okay? It's personalized care. That is the thing that the dentists need to understand. If they want to stay independent, there's a certain percentage that will always be independent, but they need to shift a little bit toward this model because, number one, it's consumer driven. This is the model that consumers want. Consumers don't want to come in to their physician and have their 7-minute primary care appointment. They want more than that. They want a relationship with their doctor, feel like they know them. Well, the dentists need to pay attention and say, oh, okay, we need to elevate our level of care, elevate our level of services, more preventive services. So dentists have always felt as if they weren't interested in preventing what doesn't pay. You know, I can do this and make a lot more money. Well, you got to pay attention. You got to pay attention. Prevention can pay.
You said this morning you can make a lot more money doing this.
Yes. Yeah, for sure.
Well, I'm a new dentist watching this, say. So what do you say to me? I've got a nice, comfortable job, and
Right.
I'm just happy, I'm making good money. Why should I even consider what you're considering?
So let's take a long-term view, a long-term career view of somebody at a starting component. I talked a little bit this morning, and this is, Bob Barkley 101, about the emotional currency, okay? This type of healthcare where you bring a high level of care also brings very high emotional returns. So what's really problematic in medicine today and in dentistry is people making money, but it's a job, it's a job, and it's, a job stands for just over broke. It's not very fulfilling, and it doesn't provide the emotional dividends. And so that was kind of a little bit of my message that, I've got some hygienists who I train that are really pretty excited about showing up for work. They work hard, and they consistently have those difficult conversations about oral health affecting their overall health all day long, and they repeat it and they don't get tired. They're very inspired.
Yeah, well, this applies to the entire United States of America.
Correct.
And practically every profession.
Correct.
Yeah.
Correct.
Yeah.
We've lost our passion for what we're doing.
Our emotional health is bankrupt.
Yes. Yeah.
And yet we're wealthy.
Exactly.
Yeah.
And that was the first thing, my first illustration today.
Yeah, I thought that was excellent.
Yeah.
Well, talk about the framework of this Bob Barkley Study Club. Paul's facility up on the mountain, this office.
No, his office, the facility at his home was, I saw pictures of it actually when it was under construction. I knew exactly what he was wanting to do. Paul has visited my home in Lexington, and I have a very picturesque setting too that's just, it's your forever home, right? So he carefully crafted that home, carefully designed it, and the meeting that he had yesterday, that was his dream, to have this group of people in this idyllic setting and very relaxed, and the mountain was nice and cool, there was a cool breeze. You can't get better than that.
And there was learning going on yesterday.
Yeah, for sure.
Yeah. So you recommend, I just heard strong recommendations to getting involved in study clubs, and specifically the one that Paul is doing.
Yeah. So the concept of this Bob Barkley Study Club is knowing that the answers to today's problem exist in the past. I'm a big proponent of studying history, and having this group dedicated to Bob Barkley's quotations and his words and his inspiration, and his son was here, and that was a super big bonus, right? To hear him talk about his father and his father's legacy. And when I got finishing speaking, he came up and thanked me, because every one of us has a direct link in some way to Bob Barkley. When we go up and say, Bob,
know it or not.
Yes. Yeah. It's pretty unique.
Yeah, it really is. Well, if you're watching this and you're intrigued, you ought to consider coming to the Bob Barkley Study Club in Roanoke, Virginia with Dr. Paul Henny and experiencing a very interesting learning experience. Thank you so much.
Absolutely.
Great.
Pleasure being here.